Good afternoon. Today we'll be presenting a topic that is of utmost public health significance, which is called polio. And specifically, the region that we'll be focusing on is Pakistan, which is my home country. So it's of personal significance to me as well. So what we'll be discussing is why polio is still a problem in Pakistan and whether or not there is being sufficient steps taken to eradicate it and whether or not those steps can lead to future eradication in Pakistan. So let's get started. As of 2018, there are only three countries that still have polio as a problem in their countries, two of which are Pakistan and Afghanistan, which are the only two that have uninterrupted polio um, positivity. Um, Worldwide, polio has fallen 99% in the last 26 years, and that's due mainly to an advent of a vaccine. The vaccine was not patented, so it made it for very cheap and allowed for it to be widely distributed across the world. Um, Currently, the Americas, the Europe, the rest of Southeast Asia, and Western Pacific are declared to be polio free, which is great news, except for Pakistan and Afghanistan. Um, the public health significance in Pakistan, like I mentioned, Pakistan and Afghanistan are the only two countries that have uninterrupted viral transmission. In Pakistan, there are five major areas. I guess you could call them states. In 2019, there were 84 cases reported in Pakistan. Vaccination efforts, although improving, still have significant resistance in parts of Pakistan. Mainly, the area that had the biggest problem was an area called Balochistan, which reports only a 35% vaccination compliance. And that is a two-tone problem because not only is there resistance to vaccination, but because of corruption and some inherent flaws in the governing bodies, um, vaccinations cannot be provided to certain areas, and they have difficulty making it there. So we'll discuss a little bit about the severity of the problem. Um, these reports are from 2019. Currently, because of COVID, there hasn't been many updated um, data on this because main efforts are being allocated towards COVID. um, like I mentioned, there are five areas in Pakistan that are of concern. Punjab, which is one of the biggest states in Pakistan, an agriculture state, reported five cases. Balochistan reported nine cases. Sindh reported nine cases, and then Khyber Pakhtunkhwa, which is a border city of Afghanistan and Pakistan, reported 61 cases, which these numbers may seem small in comparison to COVID vaccination, but uh, one thing to take into account is that polio is considered a paralytic disease. So the cases being reported here are of people that actually progress to that paralytic state. So this doesn't include all the people that tested positive, and it doesn't include all the minor infections that you can get with COVID vaccination. And I mean, sorry, uh, uh, um, the minor illnesses that you can get with polio. Um, the only cases that were being reported were of cases that actually progressed to actual paralysis. Polio is also named poliomyelitis. So that's what that is. It's a paralytic and life-threatening disease. It's caused by a virus called the polio virus. It can infect a person's spinal cord, and once it gets into the cells in the spinal cord, it can cause paralysis. 72% of infected individuals are asymptomatic. Um, 25% report flu-like symptoms that are mild. They resolve within 2 to 5 days. And then 4 to 5% of infected people usually develop paresthesia, meningitis, or paralysis. So paresthesia is loss of sensation. Meningitis is an infection of the inflammation of the surrounding layers of the brain, and then paralysis, which is self-explanatory. So the major symptoms that you can have with COVID vaccine, with poliomyelitis, are mild flu-like symptoms. These include sore throat, fever, tiredness, nausea, headache, and stomach pain. And like I mentioned, these last about 2 to 5 days, and usually people recover completely from them. Um, these are the major concerning symptoms. 1 out of 25 people with poliovirus report meningitis, and paralysis, which is 1 out of 200 people with poliovirus infection. And that reports with weakness, arms and legs, or both. And usually, when the paralysis gets really severe, it can affect the diaphragm. And once it does that, a person is rendered unable to breathe, and then they die from it. Another major concern with polio is post polio syndrome. You can kind of think of this kind of like chicken pox leading to varicella, which is that even though a person recovers from the polio virus, years later on in their life, 15 to 40 years after the recovery, a person can start to experience muscle pain and muscle weakness and even paralysis. These are some of the pictures of people afflicted by polio. Like you see, this child over here has such significant paralysis and weakness of the bones that they're rendered unable to walk up straight. And then this child who is handicapped. So let's talk a little bit about transmission. Polio is transmitted from person to person. It lives in the person's throat and intestines. Um, it only affects people, and then it enters through the fecal oral route. And usually it's through contact with feces of an infected person, or droplets from a sneeze, cough, or coming into contact with bodily fluids of an infected person, which is a less common route. Um, you can get infected with polio if you have feces on your hands and then you touch your mouth or your eyes or something like that, or you put objects in your mouth like toys and contaminate it with feces. And as you can imagine, in third world countries like Pakistan that don't have major sewage systems, that if these people are going to the bathroom in rural parts of the country, the rainwater can usually push them into um, the water supply or even vegetables and foods, and you can get infected that way. Um, the infectivity of a person is contagious from immediately before symptoms to until 2 weeks after symptoms first appear. The virus is viable in the feces for weeks at a time. So, as you can imagine, if it gets into your food supply or water supply, it will last there for a long time. Um, and then asymptomatic people, just like COVID, can still be contagious. So, what can we do to prevent and treat COVID? So, luckily, there are two types of vaccines still available, one of which is called the IPV vaccine, and that's given intramuscular in the leg or the arm. And depending on the age, it has different protocols that it follows. And it's the only vaccine that's given in the United States since the year 2000. Um, the oral vaccine is less invasive. It's just droplets that they drop into the child's mouth, and it's used. That's the main vaccine that's used throughout the world. If a child is vaccinated, it's 99% effective. And the CDC recommends that 4 doses of polio vaccine at ages 2 months, 4 months, 6 to 18 months, and then 4 to 6 years is administered. So let's say a person is born in the United States and they're traveling to an area that's afflicted with polio virus. So what should be done? Um, the CDC recommends that 1 dose at age 6 weeks or older. second dose for 4 weeks until after the first dose, a third dose 4 or more weeks after the second dose, and then a fourth dose, which is 6 or more months after the third dose. In adults, you get 3 doses of the IPV. The first dose can be given at any time. The second dose is given a month to 2 months later, and the third dose is given 6 to 12 months after the second dose. And just like any other vaccine, there are concerns for vaccination, and the people that shouldn't be vaccinated are the ones that have severe allergies. And especially if you have life-threatening allergies to vaccine components, you are recommended not to get the polio vaccine. And then if you aren't feeling well on the day of the vaccination, it is recommended to come back when you are feeling better. So some of the diagnostic tests and treatments that are available, usually it's a sample that's taken from the throat or the fecal sample, and it's a viral culture that can be taken with a respiratory tract swab. And then urine and CSF, you can isolate for them, but they have really low sensitivity. Nucleic acid amplification tests can tell you if a person has enterovirus, which is the general category of the viruses that polio falls under, but it can't specify whether or not it is polio. And then reverse transcriptase detection requires that two samples are taken from the patient. And just like the flu vaccine, flu virus, or many other viral illnesses, the treatment is supportive. You let the patient work it out, and then you treat symptomatically for the individual symptoms. Currently in Pakistan, cases increased 15-fold between 2018 and 2019, which is concerning because the rest of the world is decreasing and Pakistan was increasing. In 2017, there were 8 cases that were reported. From January 2018 to September 2019, 84 cases were reported. And then infected patients range from the age of 2 months to 12 years old. So currently there is surveillance for both AFP cases and contaminated environmental sites. Sewage testing was performed at 60 sites. 45% of the tested sites reported positive in 2019, and then 15% in 2018 and 16% in 2017. So major improvements in sewage and waste disposal are needed. And clean water supply and clean foods are imperative for people living in these areas. So in terms of interventions, the supplemental immunization activities have been implemented. These have taken precedence in particularly in high risk districts. As of August 2019, 19,274 community healthcare providers have been deployed to 15 districts. Um, and there has been specific focus between the borders in Afghanistan and Pakistan, and screening has been done for people that are migrating across the border. And then there are continuing studies being done to provide information on the epidemiology so that better resource allocation can be administered in Pakistan. So what's the big deal? The big deal is that it's a simple solution. It's a very cheap vaccine. The rest of the world has eradicated the polio virus. And if we can do it, we should do it. It's a small problem, but in relationship to other major illnesses, but it can significantly improve the quality of life for tens of children. And the goal would be to have worldwide eradication. If polio was eradicated, it could save up to 40 to $50 billion globally. So there's major economic incentive to eradicating polio virus because that money can be used in other areas and other districts. So some of the challenges Pakistan faces with their polio fight is, as you can imagine, the Taliban, the Al Qaeda, and the Boko Haram movement in Nigeria are major hurdles in eradication of polio. These organizations not only prevent vaccination supplies from reaching the areas, but they also control major parts of some of the regions and consider Western medicine to be not suitable for their regions. And then the other hurdles that Pakistan faces currently is the development of a health system, which is kind of currently facing major corruption and significant hurdles of its own. And then the country as a whole could significantly benefit from improvements in sanitation. So, what should be done? As a country as a whole, we need better public education. Television programs need to highlight the inadequacy of Pakistan compared to the rest of the world. And I truly believe that if more of the public is educated on how Pakistan is lacking compared to the rest of the world in the fight against polio, that there will be major steps taken to improve. Um, Currently there are polio campaigns, and then we need to increase governmental funding to allow people such as public health workers and vaccinators to reach these afflicted areas. Um, Not only do we need vaccination education, but the regions that are afflicted can significantly benefit from religious education, because many of the areas believe that it is against the major religion, which is Islam in Pakistan, that it is against Islam to have something injected into your body, which is certainly not true as per the fatwa that's given by majority of the religious leaders around the world. Um, and then one other major concern is to provide security for vaccinators when they're headed towards areas that are troubled with terrorism or non-governmental entities controlling the areas, so that they can feel safe and provide vaccines to these afflicted children. Um, and with strong commitment, seriousness, and good initiatives, polio will be eradicated from Pakistan within 2 years, which is the hopeful goal for the country as a whole. And these are references. Thank you very much for taking part in this presentation. And that concludes my presentation.